Hello, how are you doing today? I want to answer one of the questions that most of our post-operative patients do ask us. Next, when am I supposed to resume feeding after this surgery? The answer is that it depends on the type of surgery that was done and the type of anesthesia that was used. For minor surgeries like incision biopsies, like tooth extraction, removal of ingrowing toenail, uncomplicated hernia, and so on. Short anesthesia is usually used, sometimes local infiltration. You know that the recovery from anesthesia is faster. The patient can eat within 2 to 6 hours, and that time you are sure that there is no vomiting. Patient is still is fully awake, and then there are bowel sounds. The patient can resume oral sips, graduate to soft diet, and go ahead and eat. But for major surgeries like thyroidectomy, hysterectomy, cesarean section, neurosurgeries, prostatectomy, and all the major surgeries, feeding has to be delayed because of the anesthesia that was used. You know, when you use general anesthesia on a patient, it paralyzes even the digestive muscles. Peristalsis is not happening, and the bowel sounds are not present. If you go ahead and eat that time, there could be aspiration, there could be post-operative vomiting, there could be abdominal distension. Listen to me. Anesthesia makes the bowel to go into sleep. Post-operative ileus. It causes the bowel to also to be slow in movement. There is also a risk of aspiration, and then swallowing reflex is very, very slow. So because of this, there could be aspiration, there could be vomiting, there could be abdominal distension, there could be wound breakdown when the patient is vomiting, and you know you have put yourself into deeper problems when you eat before the time you are supposed to eat. I say that you should wait for 24 to 48 hours. Within this period, there might have been bowel sounds which should be confirmed by the doctor using a stethoscope, or him having to ask you whether you have passed flatus, whether you have passed flatus. It's only then that he will ask you to start oral sips, progress to soft diet, and then you go ahead and continue eating. Please wait for medical clearance post-operatively before you eat. Do not assume that hunger means that you must have to eat. Please, good visitors that are well-wishers, do not fall into the temptation of hiding to give food to post-operative patients before you cause a bigger problem that will make them to return back to the theater. So, like and share so that others will benefit from this.